was named the German surgeon James Adam Israelii on 1848 to 1926, who studied the organism for the first time in 1878. A species of the bacteria that is commonly found in the human body is usually in the nose and mouth. Under the normal circumstances, it was harmless to human. However, sometimes it's moved further in the body through a break in the mucous membrane. When this happens, problems develop. When Actinomyces israelii gets into the place in the body, it causes a bacterial infection called actinomycosis. What is actinomycosis? Actinomycosis is rare in the United States but is more common in tropical region of the world. It may also be referred to Revolta disease, big jaw, lumpy jaw, clumps, and wooden tongue because of the side effects that commonly affect the mouth and the neck. Now that we know what is Actinomyces israelii, let's take a look at the symptoms of actinomycosis. When the bacteria enters the body, it can form an abscess of the soft tissue. An abscess is small, pus-filled sore. As the abscess enlarges over time, it can break through the skin surface, causing sore. These abscesses or lumps commonly affect the head and neck, and they can cause muscle spasms that prevent a jaw from moving properly, also known as lockjaw. However, they can also form in the lungs, stomach, and intestine, in addition to the stomach, nose, and throat. Other common symptoms including fever, weight loss, cough, chest pain, and excessive drainage from the sinus cavity. Symptoms may be slow to develop, but early treatment is key to speedy recovery. Let's proceed in a gram stain. A. Israelii, a gram-positive bacilli, facultative, anaerobic, and grow best under anaerobic condition, grow at 35 to 37 degrees Celsius. Slow growth on blood agar in 4 to 7 days. The appearance of blood agar is smaller tooth. Actinomyces species may form endospore, and while individual bacteria are rod-shaped. Actinomyces slowly progressing prognosis relates directly to early diagnosis, as in most viable in the cervifacial form and progressively worse in thoracic, abdominal, and general form. How it's get a Israelii? Developed due to poor dental hygiene, tooth extraction, appear as a tender swelling that drain past to the sinus tract. Multiple sinus scarring on neck and submaxillary area. Usually, is typically grow on this part. How it mode of transmission of the bacteria. The Actinomyces species commonly inhabit the oral cavity, the gastrointestinal tract, and the female genital tract. Where they exist, the commensal infection occur when mechanism disrupt the mucosal barrier or organism gain access to. Privileged site. For example, actinomycosis commonly occurs from dental procedure, trauma, surgery, or aspiration footnote. Actinomyces species is also presumed to be transmitted via direct contact between individuals part of normal flora. How to treat actinomycosis? To treat actinomycosis is a long-term high dose of penicillin. For severe cases of intravenous, penicillin followed by oral penicillin. Tetracycline and erythromycin can be used. As a bacterial infection, actinomycosis, most effective treatment is antibiotic. Such as penicillin, they can eradicate the bacteria but take long to do so. Sometimes up to a year is needed to banish the infection. The key point of all this, what I'm saying is actinomycosis is usually involved multiple small communicating abscesses with sinus tract that drain a purulent discharge. Infection is typically involves the neck and face, lungs, or abdominal pelvic organs. In microscopically, Actinomyces appears as distinctive sulfur granules, rounded spherical particles, usually yellow and greater than 1 mm diameter. Is a tangled masses of branches, wavy bacterial implements. High dose of penicillin is usually effective but must be given long term. It's usually at 8 weeks to 1 year. Surgery to drain abscesses and excess fistula may be needed. Thank you for watching!